It is 4 p.m. in the Eastern Caribbean, 3 p.m. in Jamaica. That makes it 2 p.m. in Belize. Good evening, good afternoon, and welcome to this Facebook Live session of Let's Talk Access, a social media program produced and presented by the UWI Open Campus. I am your host, Cleveland Sam. Today, we are going to focus on a very special program that the UWI Open Campus and the Caribbean Institute of Health Research are offering together, a postgraduate diploma in health research and epidemiology. I have some very special guests, but I want to say thank you for joining us wherever you are on this World Wide Web, on our platforms, Twitter, LinkedIn, Facebook, as well as Instagram. Thank you so much for joining us. I'm going to introduce my guests this afternoon, and then we're going to have a discussion. Remember that you can also participate by sending us your questions in the chat feature on our social media platforms, and we'll relay your questions to our panelists. So, Ms. Kathy-Ann Lashley is a program manager in the program delivery department at the Open Campus. Good afternoon, Ms. Lashley.
Good afternoon, Dr. Sam. Good afternoon, my colleagues, and good afternoon to all of you who are live on Facebook with us. Welcome.
Professor Trevor Ferguson, and he is the Director of Epidemiology of the Epidemiology Research Unit. Professor Ferguson, welcome to Let's Talk Access.
Okay, thank you, Dr. Sam. Good afternoon, everyone. Good afternoon to all those who are listening. It's certainly a pleasure to be here today.
All right, and no stranger to Let's Talk Access is Mrs. Natalie Guthrie-Dixon, and she is a lecturer as well as a statistician at the Epidemiology Research Unit. Natalie, welcome.
Thank you so much for welcoming me, Cleveland, and good afternoon to everybody who has joined us today.
All right, good to have you back. And finally, but certainly by no means last, Dr. Lorianne Fisher, and she's a graduate of this program, but we will let you know a lot more about Dr. Fisher as the program proceeds. Dr. Fisher, good afternoon. All right, I think Dr. Fisher, your mic might be muted.
Right, I'm sorry about that. So okay. Thank you again for having me. It's good afternoon.
I'm really happy to have this esteemed panel this afternoon, taking an hour out of your very busy schedule, I'm sure. I'm going to start with Professor Ferguson and epidemiology. What exactly is epidemiology for the person who might have never heard this term before? Professor Ferguson.
Okay, so thank you. So epidemiology essentially is an area that looks at health research. The common definition is that we look at the distribution and determinants of health-related states and events and how we apply these to public health problems. So essentially, we want to know how much disease there is in a population, what are the causes of these disease, and what can we do about it. And that's essentially somewhat the epidemiologists do.
Right, and I'm going to ask my friend Natalie about health research because she's the statistician and the lecturer there. So Natalie, what is health research? What are we talking about when we talk about health research?
So when we talk about health research, anything related to health, so we could look at dentistry, we could look at veterinary medicine, we could look at anything public health, anything related to health, we look and see, okay, what is our problem? And then what are the things that we can now look at to see that are causing the problem? Can we look at what can help the problem? Can we create models? If it is, we need to create a model to try and fix things in the future. How much of it exists? Why does it exist? Those are the things that really and truly make up health research.
All right. And I want to ask you guys, because we are now it's now a year and a few months of the coronavirus pandemic. How has epidemiology and health research helped us to manage this pandemic in the Caribbean? And I mean, all of you can respond in your respective fields.
Okay, good. So clearly epidemiology is the cornerstone of dealing with infectious disease outbreaks, which essentially is what we are dealing with the COVID-19 pandemic. What is happening is that this is now a very large and massive outbreak. Now, from the very beginning, we have to be able to look at trying to understand the origins of the disease, where it started, who are the people who are affected, what are the outcomes, identify persons who are at special risk, and also to look at what treatments may be applied. And this involved the use of clinical trials. The development of vaccines would have been tested in clinical trials, which is one of the key areas of epidemiological research. So it really starts with being able to count the persons who have COVID-19. I guess most of us are very familiar now because counts are reported every day. So we need to know.
Yes, the dashboards are like part of our lives now.
Right. How many people have it? Who are the people who have it? And then trying to identify patterns. Of course, we do the things in terms of projections by looking at the epidemic curve. So you can look at patterns, and you'd have seen a lot of these graphs that persons have produced, trying to see the number of cases and see to predict when we have a peak, when there may be a peak, and so on. So essentially, in collating all of those data, analyzing the data, using the data to create models would be a part of determining the public health response. How many nurses and doctors do we need? How many vaccines do we need? How many, in terms of doses of particular drugs, do we need in order to respond to this pandemic? So all of this is part of the field of epidemiology. And of course, monitoring to see how things change over time will be critical.
And to just add to that as well, so Trevor did mention the modeling. So even now in Jamaica, I'm not sure exactly what's happening in Barbados, in your neck of the woods, Cleveland, but in Jamaica, when we have all of these curfews on the weekend now, what you're hearing from the government is because of the data that we're providing, it's saying, okay, there is a greater risk if you're not seeing people wearing the mask. And so we're putting that within our model to see, okay, what is the effect on the counts? We're looking at, okay, is it a lot of mass gatherings? Why it is you're seeing the numbers, which is common sense. But of course, we're trying to use the data to create the model so people can understand that this is what the data says, and therefore these are the decisions that we are hoping to make.
This is very relevant. This course is very relevant to the entire COVID-19 pandemic and helping our response.
Well, certainly. And of course, one of the things that I think has come to the fore is the need for more persons with training in epidemiology, and also for more persons with training in infectious disease epidemiology. So I think this is critical that we continue to offer and provide the opportunity, because our response is often limited by how quickly we can produce and analyze the data so that the various public health decisions can be made.
Great.
Right.
And Dr. Fisher?
Yeah, from a practical perspective, certainly on the grounds, managing patients, kind of understanding the disease course in Caribbean patients. So there's not a lot of data coming out of the Caribbean, because people, our experience in the Caribbean may be different from what is abroad or in the US and UK, and also applicable to other places, which is why it's very important to maintain or create data from the Caribbean, because our experience may be different, and it may also add or actually increase the knowledge with, how does this disease evolve in a different environment? How do we respond to these patients? And therefore, that is why data coming out of the Caribbean is going to be very important, not only for the Caribbean to guide policy and to guide decisions, but maybe important for the rest of the world. So a different perspective on how to manage diseases and the processes that lead to, or the determinants of diseases in different populations.
And I think that's an excellent point.
Yes, go ahead. Excellent point. Go ahead, Natalie.
The reason I say that, of course, in terms of where it is we had as a vision, the reach for our program, it first was with our region. So we wanted to really and truly reach as many persons in the Caribbean so that would be interested in trying to build our cadre, be able to present research output to the world so that as a Caribbean, we can say, okay, as a region, we do have this kind of output in research. From that, yes, we'd love to go to Africa as well. You know, my director of my institute, that's where he wants to go, but we at least the genesis is here so that we can now expand.
Yes, and I was saying, Dr. Fisher's point is so critical because very often when we are looking for data, we can find data on almost every other region in the world except in the Caribbean. So I'm really happy that people like you, Natalie, and now Dr. Fisher, and of course, Professor Ferguson around, and you're trying to train other Caribbean nationals, particularly as it relates to the health research aspect of the program. So now let's focus on the program because that's what we're here to talk about. So it's a postgraduate diploma, and I'm going to ask my colleague Lashley to come in. It's a postgraduate diploma in health research and epidemiology. Ms. Lashley, what was the rationale behind us offering this program in the first place? Is Kathy on there?
Yes, I'm here. And the rationale for offering this program in the first place is basically to provide training for those healthcare workers in the field. We recognize that we have healthcare workers in the field who, unfortunately, because of what is happening now in the environment, COVID-19, may not be able to, attend a physical institution to further their studies in this particular area. So at the Open Campus, because we are online and we can provide that flexibility and convenience, those were some of the reasons for offering this program. We also wanted to make sure that we provide an opportunity to fill this need. We also wanted to serve as a starting point for a career in health research for those persons who needed qualifications to ladder into a master's program in research and epidemiology.
Okay, thank you so much. And Natalie, we are partnering with your institution, both you and Professor Ferguson. Was there a situation where your organization came up with this and you said, who should we partner with? The Open Campus is the obvious choice. How did this collaboration come about?
No, that actually was a journey, but yes, Open Campus really and truly turned out to be the better choice for us to partner with because we thought of the different needs of our target audience. Because as Dr. Fisher has told you, she holds many hats over there by UHWI. So she has quite a lot of things to do. So to say that she's going to come and sit down for, a certain period of time for face-to-face classes was difficult for her. And obviously, though, we have other programs that are face-to-face, but it's the needs of the particular person. So for this particular program, we looked at persons who really and truly their schedules, it would be better for them to have gone to an online delivery, So with the Open Campus, that flexibility was just ideal. And with the fact that it was just an introduction, really, we could say, let us work together and figure out what kind of courses we could partner with Open Campus to create.
All right, great. And go ahead.
Just come in and add. So one of the things that you will recognize is that we do generate a lot of data as part of our general clinical care. However, many of our clinicians may not have the requisite experience in writing up research and conducting research. And as Natalie has said, that most of persons may not have the time to stop their current day-to-day activities to do a program. So we really wanted to provide something that the clinician could participate in. They could do it at their own time and at their own pace. And really to change the landscape where we can document our experience in clinical care, as well as provide opportunities to answer questions that otherwise would not have been answered because of the skills that are unavailable. And then there are other persons who have an interest in health research or epidemiology, but may not be as sure as if they want to make a commitment to this. So this provides an opportunity for persons to start the process, to get exposure. And of course, we expect that many will develop the level of interest that will want them to go on to do the full master's or go on to develop a full career in terms of a PhD program in epidemiology and contribute to solving the health problems of the region. So I think this is important as a starting point in improving our ability to address the health problems of the region.
Certainly.
Can I add something to that as well?
Go ahead, Dr. Fisher.
Sure. So certainly, like I must kind of reintroduce some people in my group or in my class at the time. It was kind of a very varied background. So most were physicians, but one was a pharmacist, and different levels of care. So some were in hospital, academic, some were just in the beginnings of their career, right? I think what drew me to the program was, flexibility. So my time was, the sessions were usually in the evening. So most times you'd be able to meet in the evening. And that's why the open campus format was very useful. Two, although we as clinicians have the skill to learn or clinical background, we learn it in medical school, we learn it in training, although we do learn some research techniques or methods in medical school, to kind of begin or to start asking questions or attempt to answer questions through research, we kind of need this program provided like kind of the initiation, the basis of understanding health research. Additionally, also help with project management, things like that. So they were also both theoretical and practical. And I think that is one of the strengths of the program, is that it's geared really towards clinicians, and people within healthcare, who also are working, but at the same time, the flexibility and the time with the material, which was very, very useful, is kind of beneficial.
Thank you so much for that intervention.
Very beneficial.
And to draw on to what Lori had said in terms of the target population. So yes, we had a pharmacist, but we also want to say that we are open to persons who work in the ministries, persons in policy for health. So those kind of persons are still more than welcome in the course. Yes, you do need to have your first degree, and preferably an honors degree, one of the honors. But we do not just cater just to clinicians. That is an extremely good point that Lori did make. In terms of, even as she said about practicality versus theoretically, we do have 6 courses for the program, but also we have the 5 of them are standalone courses. So again, if you just wanted to look at even an area that you in your professional life wanted to just enhance, you could also look at those 5 courses as standalone courses. Let me know if you want me to tell them yet, but
I'm going to come back to that, but I wanted to just background Dr. Fisher a little bit so that people understand her context somewhat. Dr. Fisher, I wanted to just come back to you. So can you just tell us exactly what you do as a profession? Because you're a doctor, but you're not a PhD doctor, you're a medical doctor. So just tell us a bit about what you do, and then I'll ask you a question.
Okay, so I am I'm a nephrologist at the University of Hospital of the West Indies, and a nephrologist is a kidney doctor. We take care of patients on dialysis. My background is that I did my first degree in medicine, Bachelor of Medicine, Bachelor of Surgery, and then I did subspecialty training in internal medicine and nephrology. I'm currently a consultant at the University Hospital of the West Indies and an associate lecturer at the Department of Medicine.
Right, but you saw the need to pursue this postgraduate diploma in health research.
So the reason for me approaching this is in clinical practice, I had an interest in research because of just simple questions and the recognition of kind of like a lack of data on Caribbean patients. Especially when it comes on to kidney disease, which is a growing problem in the Caribbean. So a big problem in Jamaica and in the rest of the Caribbean as well is this proliferation of non-communicable disease, such as high blood pressure, diabetes, and kidney disease. And kind of in order to understand a problem or in order to implement policies to change the problem, you have to recognize that the problem exists, right? And so it was from interest that I decided to kind of pursue this degree, just because of my own recognition that I didn't have the expertise or I didn't have the ability to begin formulating research questions and also formulating research ideas or concepts in order to get that information out there. And that was the basic reason on me joining this program.
All right, great stuff, great stuff. And you are a great testimony to the need for this program in the region. I'm going to go back to Natalie and my colleague, Ms. Lashley, regarding the structure of the program before we look at the actual subjects. What is the structure of the program, Natalie and Kathy-Ann?
Well, the program is a 21 credit program consisting of 6 courses. 3 of those courses are 4 credit courses and the other 3 are 3 credit courses, bringing to a total of 6. In addition to those 6 courses, students also have to do a mandatory online graduate course to prepare them for navigation in the environment.
All right, and what are these courses?
These courses are fundamentals of epidemiology, fundamentals of statistics in health research, research methods, research ethics and project management, principles of epidemiology data management, appraisal of the medical literature and preparing scientific manuscripts. And then there's the research paper, along with the mandatory graduate orientation course.
All right. And Dr. Fisher, how did you find the courses? Were they heavy? Were they manageable?
At times they were a little bit challenging. I'm not going to say no.
Right.
Especially, a few of the courses were challenging, and anything worthwhile doing should be challenging, right?
Of course, yes.
But I mean, it was manageable, and I must speak to the support system built within the program. The lecturers were very good. There was also a very good line of communication. So, if there was any problems or any issues, or if at any point you were feeling overwhelmed there was always a communication and kind of a problem solving together. Say, okay, well, you're falling behind on this. What are the issues? How can we address them? And it was geared towards your success, right? Ultimately. And I felt that way. I felt that the lecturers, the support team had your interest in, being successful. And that's really important for any program.
Great. And I see Natalie's itching to go. I'm not sure, but you could go ahead, Natalie, if you wanted to add anything.
Honestly, in terms of the main thing I wanted to add is hitched on to what Lori said in terms of the success. Mm-hmm. The program, our vision at CARE and then, affiliated with Open Campus as in helping us to achieve that vision is to make sure that we are successful researchers. Mainly, yes, starting from Caribbean. Eventually, we're looking global. We're not tying in where our reach will be, but it is for the success of the researchers, because we do want to effectively make a difference. That's what we want to do. So, and this is just, as we say, the genesis. We're just starting off with these 6 courses. We're not in any way expecting persons to be, yet on the Johns Hopkins kind of league, but we are starting here, hoping to reach further. So that really is what I wanted to say.
All right. And Lorianne, you were in the first cohort, were you? Because you have graduated now.
Yes. We are the first cohort.
Guinea pigs.
Guinea pigs. I was about to say I wasn't sure if that was appropriate, but yeah.
That's fine. After all, this is research, so we do need guinea pigs. Right, Professor?
That's true.
There was lots of feedback, and that was really important as well. So that was also a strength of the program, is that they constantly sought feedback to make things better, and I think that's really important. As the first cohort, yes, there were challenges, but I think we were able to work through them. It's something that I'm very, very happy that I did in retrospect. I'm still using and a lot of the skills that I've learned, I'm actually still using them in the process of doing other research questions and papers that I'm planning. So it was actually a very, very useful thing, and really recommend it to everyone.
All right, Professor?
Well, now I'm certainly in terms of we were really delighted to see the first cohort of students come through. So the program was really the brainchild of our current director, Professor Marshall Toller-Reed. And it took a while to get it off the ground. So I think being able to be here and to have our first set of students graduating, we're now working with our second cohort, and we want to look forward to increasing the numbers of students that we can see and so on, and really improve the program in terms of delivery and so forth as we go forward. And in the future, we do envision additional components being added. But of course, we want to ensure that we do our growth in a manageable way. But the opportunity to really be the hub for health research training in the region, what is that we would want to become, and clearly to also have relevance beyond, where we can make that large impact.
Great. All right, as you said, the reason we are here is to promote the program, because we have another intake coming up in September. And I'm going to reach back out to Ms. Lashley to tell us about the application period and the entry requirements.
Yes, the application period for start in September was January the 25th, and we're going to close applications off on July the 11th.
Okay.
Deadline for students to submit all their documents will be July the 31st, 2021. We do 2 intakes. Semester 1 and semester 2. So for our semester 2 intake in January 2022, that application period is going to open up and will close off around November. We're going to probably open the application period around late September, and it will close off November for our January intake. Interested persons should go to our online website. Sharice, you can post the link in chat. They can fill out the online application form. Go to our admission portal. There's an instruction sheet that students should follow. Any person who's interested should follow the instruction sheet and complete the application. The entry requirements, as mentioned previously, for this program, we prefer students to have a bachelor's degree, any health-related discipline, and preferably an honors degree. And persons who want to come in and take a course within the program, we do accept specially admitted students. If you're interested and you want to come in and take 1 or 2 of the courses in the program and you don't want to do the full program, that's also an option for you.
All right, so great. And then the length of the program?
Well, this program is a 15 months program, but students have up to 3 years to complete it.
So they can start, how does that work? Is it that they can carry different loads at different semester? Is that flexible?
Yeah, I can talk about this. So because we have a small cadre of actual facilitators, we have set how it is that you can come in by semester in terms of what courses are offered. So for semester 1, we do have our research methods, research ethics, and project management course offered in semester 1. We also have the appraising the medical literature in semester 1 offered then. And we also have the research paper offered in semester 1. Now, research paper, however, can also be offered in another semester depending on where it is the student has reached. Because research paper, that one is the only one that has prerequisites. In other words, the only way they can do research papers if they have done the other 5 courses. So that's semester 1. For semester 2, it's the epidemiology and the statistics that are offered in semester 2. And we learned that with our guinea pigs, with Dr. Fisher, because yes, because the epi and the stats, those are the heaviest courses. So we've learned that we have to offer those either in semester 1 or semester 2. So the epi and stats are going to be offered only in semesters 1 or 2. So right now it's semester 2. Because of our cadre, because we can't offer them both in semester 1 and semester 2 right now.
At the same time.
Exactly.
Right. Gotcha.
And then in our summer semester, we offer the data management course. Mm-hmm. And that would be all that's offered in the summer semester at the moment.
So one course at summer?
At summer, yes.
Right. So I heard both you and Ms. Lashley spoke about standalone. Before I start, I don't know if Professor Ferguson wanted to add something.
Well, not specifically. The idea, of course, is that we take persons will start, in essence, the order in which you do the courses may vary depending on which semester you start. And then it may, but if you do all the courses, you're able to finish within the 15 months, but you can choose to do one course in semester 1 and one in semester 2. Therefore, that can extend the program to a maximum of 3 years because you have on 5 courses before you do the research paper.
Great. So there's lots of flexibility. So people like Dr. Fisher, who have a very busy schedule, can still study effectively.
Yes, you don't have to take on more than your current schedule can manage. You can do a single semester and still finish on time. Sorry, Natalie.
No, I was just gonna say, and just as Dr. Fisher has, very, very, very what should I say, urgent things. And, that flexibility. And just like even now, she may actually have to leave us now to go and do the particular things that she has to do on the job. But yes. So it's a flexible program to just, have her needs in mind.
Right. And let's just look at another aspect of the flexibility that I heard both Ms. Lashley and you spoke about, Natalie, and that is the standalone courses. I think that's a really good feature of the program, that if you do not want to do the entire diploma, you can just take a particular course that you're interested in?
Yes, you can. Out of the 5, just not the research paper, definitely.
How have you find that people have been taking this option?
Actually, we haven't had many persons take up that option. We're hoping that maybe, as the time goes by, people appreciate that, okay, if I just want to learn a little more about epidemiology, because that word has been, said a lot in the past, COVID.
Exactly. Right. COVID times, yes.
Exactly. So with COVID, with this COVID times, that's how this particular standalone feature can work. Dr. Fisher can, just join in here as her last comment, to just let us know, appreciate that if you just did data management alone, how that would have helped you in your particular
All right. So, a lot of us don't get exposure to data management. So this course is actually very refreshing. So even if you're doing the data management course by itself, like things like learning a skill like RedCap, for example, I'm just giving an example, which is just a database that helps you collect health information, kind of understanding that and that skill, just learning how to do that is actually just a very big help because that actually helps you kind of even as a physician, when you're starting to learn about, databases, data sets, learning about those things, and, improving your research expertise. So, as a standalone, it was an excellent kind of introduction and very helpful practically.
Great. And just to remind our viewers, if you're just joining us, We are speaking about the postgraduate diploma in health research and epidemiology being offered by the UWI Open Campus in association with the Caribbean Institute of Health Research. And I have 4 special guests, and they're providing all of the information that you may need on this program. So as you heard just now, you can take one standalone course. You do not have to do the entire diploma. You can take a standalone course. You might be interested in the fundamentals of epidemiology or introduction to statistics. And I'm sure in this time with all of the COVID situation that we have, where data is such an important factor in driving the management of this, that I'm sure that health authorities around the region must be recognizing the need or the importance for a course like this, Professor Ferguson.
Well, certainly in terms of looking at even how we collect data, how we store data, that's going to be important, and being able to use the data in a meaningful way. One of the challenges that we sometimes recognize is that a lot of routine data are collected, but the ways in which the data are collected, the way in which they're stored, the sort of codings and stuff that we use make it very difficult to analyze. So when we learn these basic principles, including those contained in data management, it allows us to put together databases that can be used for years in the future, and really helps us to use our data very well and be better able to address the problems in a proper and efficient manner.
All right, Dr. Fisher, I understand you have to leave us, and we understand that. Thank you so much.
Thank you so much for having me. Thank you so much. Thank you.
All right, take care. Bye-bye. All right, we say thank you to Dr. Lorianne Fisher, who joined us, and we know that in her field, sometimes emergencies come up, so she has to go. It was interesting that a couple of weeks ago, we were doing a program with Professor Richard Robinson, who is the volcanologist in St. Vincent, and he was telling us the same thing. I have one eye on this program, but I have something in my ears, and if the volcano blows, I have to leave. So we understand that very well at the Open Campus. We are all about being agile. So, yeah, as I said, I find the feature of the standalone program really interesting, because as you know, quite often, someone may not have the time or the resources to do a full 15-month or 3-year commitment, but they may be able to do 1 semester and say, well, you know, I always want to do something in statistics, and I work at the Ministry of Health, so let me try and do this. So that's a really good feature.
And what we're trying to work on, I mean, it's still in the, you know, the works, is that we'd love to still be able to say, okay, you can either say you've earned a badge or you've gotten a certificate for doing this standalone particular course. So that is in the works to figure out exactly how we award persons who wish to
micro-credentials.
Yeah. And I wanted to just come in a little bit here on the individual courses. So for example, the Introduction to Statistics is a course that could be extremely useful for many persons. So sometimes persons may be able to work around some of the other aspects of the health research construct. But for statistics, you have to know how to use specific software, apply specific principles. And so if persons are conducting research and you need some help in statistics, then this would be an excellent idea for you to look at that if you're not able to do the full diploma. But certainly statistics is an area that we need a lot of help in terms of, we have few qualified statisticians in the region, and Natalie will tell you that sometimes they're getting calls left, right, and center, and not really able to respond. So we really want to promote statistics as one of the courses that persons can do, and certainly will go a long way in improving our research output.
Well, I sincerely hope that our colleagues from the Ministries of Health across the region are tuned in or will look at this video. and that your appeal will in fact have fallen on some very receptive ears. Sorry, Natalie.
Right, I was just saying, and then again, it's not that they'll be able to do many different models and, be able to create them, or, to that genesis, it's going to be able to make them be skilled to do that, but it's the start, and it's the start of where can you now say we have certain skills to start off, just even creating what we need for our results and creating our paper, even if it's a simple paper, and then from there, have the desire to move on, to say, let me learn some more. Because to me, it always is that lifelong learning is an important thing for everybody to want to learn more. That's where we come in. We want you to have that burning desire to learn more.
To learn. And we're certainly providing the opportunity to do that. All right, let's go back to my colleague, Ms. Lashley. What type of assessment is done in this program currently?
Well, this program is delivered fully online, 100% coursework, with assignments and activities, or everything is submitted online. Some of the activities or the coursework pieces could be online quizzes, research presentations, term papers, research papers. That's the format for the majority of the assessments.
All right, and I cannot forget, sorry, Natalie, you're gonna
and we try our best to make it as engaging as possible. So like even the presentations that we taught for the different courses. So depending on what the course is, you may have more reading, for example, for looking at the preparing the scientific manuscripts course. So they have to read, but they still have to do engaging presentations to say, okay, we've read and this is what we've learned. With the statistics, they have to be able to use or manipulate the software and say, okay, we've done it. This is what we have come up with. With the epidemiology course, we may have a plenary or we may have a debate just to kind of let us say, okay, we've gone through material. This is what we think, and we kind of do an engaging kind of presentation so that the students appreciate what it is they've learned.
Right. And as Ms. Lashley said, this is 100% online. And I know in the past, there was some question about whether the student, apart from the research, if they had to do some sort of attachment, is any sort of that involved here with the program, that they can be attached to a unit or Ministry of Health or an organization somewhere? No?
In terms of like their prior learning experience, I'm not sure.
No, in terms as part of the program, if there's any requirement for them to spend some time with a health institution.
Okay. Yeah. Well, that's what care is. So for us, really, a lot of times is that we would have those data sets ready for them, because of what we do at CARE, because we're a primary research institution. So attachment is really with us. I don't know if Professor Ferguson wants to add to that.
Yes.
So, yes, I can definitely add to that. So one of the main outputs is a research paper. So with the research paper, you are paired with a specific supervisor who would be a member of faculty. And then you will work with that faculty member in producing your research paper. So of course, we often provide the data sets, and we provide the support in terms of both the content expert, in terms of the person who has some knowledge of research in the field, as well as the in terms of involvement with the statisticians, so statistical support. So in essence, while it's not a physical placement, you are now paired with a team to carry out your research project and to take that from the start to the finish.
Great, great. So there's some guidance provided, professional guidance.
Definitely. Provided. And it's for the research project, it's one-on-one. Well, so, well, it may be one, more than one, because you have this primary supervisor plus your statistical support. And
All right.
so it's really individualized.
Great. I want to ask about careers and salaries and income, which is things that people are very interested in. But I want to ensure that we take this comment from one of our YouTube viewers. This person has a bachelor's degree and a master's degree in nursing. However, they are not honors degree. Can they access this program?
All right. So
bachelor's and master's in nursing.
Right. So what we do is that we look at the person's profile. And so the general requirement is that persons with an honors degree would be preferred. But once we can demonstrate that the person has the competence and the experience by reviewing their transcript, etc., then the person can be considered for the program. So it's not an absolute requirement, but certainly it would put persons at an advantage. But so if you didn't have an honors degree, don't be dissuaded from applying. We will look at your transcript. Where necessary, there may be the opportunity for an interview. Look at what you have done since your initial qualifications. And certainly once there's a case to be made, then that would be, it can be done.
All right, so Desmond, there you go. Submit that application as soon as possible. So one of the things we always get from our prospective students, particularly younger students, has to do with career paths that are available in these fields. Someone who has training in health research and epidemiology, what sort of career paths are we looking at?
All right, so I could probably start. So it depends on where you are when you start the program. So if we think of someone who has a bachelor's degree and does the postgraduate diploma, then it will now give you basic qualification in health research and will allow you to begin to work in the field. Most times persons will start as a research assistant, and from there we'll be able to move up the ladder, usually with additional training. So we would encourage persons to go on to complete the full master's, and in which persons may be able to work in the government agencies such as the Ministry of Health and various other government ministries. There's opportunities in within universities working as research assistants, research coordinators, etc. And also the skills can be applied in industry. There are persons who do data collection for things as broad as polling to laboratory type research, etc. So the field is very broad that persons can have an opportunity to start within the research environment. Usually, of course, the salary is going to be dependent on the specific field. But if you have a postgraduate diploma or a master's level degree, then you will have certainly a decent starting salary. Now, beyond that, there are opportunities in government agencies as well as policymakers, as data analysts. Persons may also develop greater skills in statistics and so on. Then for persons who have prior clinical experience, those can really advance in the field of clinical research. So for example, somebody who is clinically qualified and already at the, well, in terms of the requisite professional training, if you were to think, for example, within the academic environment, within the university, you often hear people talk about publish or perish. So a lot of persons have been stuck in their career because they haven't been able to produce research papers. This would be the ideal solution, because we would take you through the process from developing a research question, beginning the process for the data analysis, your data management, writing the research paper, reviewing the scientific literature. So here now someone can really climb the academic ladder because you're given the skills to really advance your research career. So that's the clinical researcher or the academic physician, academic researcher, etc. So it's really broad and it depends on where you start. Additionally, we accept persons from a social science background. So you may be able to do social science research as well as population-based research, etc. We have, for example, this is coming out of our master's program, persons working like in places like the Planning Institute of Jamaica. Some of our graduates have gone on after additional study to work for places as like the CDC in the US and so on. So the opportunities are varied. They are quite good. It's important, though, that it's not considered a quote-unquote terminal qualification.
Right.
Most persons, if you have not yet had a professional qualification, would expect that you would do some more afterwards. But for the person with full professional qualification who wants research to help you advance your career, this is an excellent opportunity. And maybe all the formal training that you need, although you will continue to learn as you go along.
Great point. Great point. All right. So just to remind folks that we are taking your questions and comments as well on the social media platform. So you can just type them in there and I will relay them to our special guest.
I just want to go to Desmond's question. I think that's the person's name.
Yes.
In terms of for their application, one thing I do want to urge them to make very clear is a statement of intent. Really and truly, what is your burning desire? What do you want to really research and learn more about? That must come through in the application as well. Especially as you say, if it is that it's not an honors degree, then make it clear to us what really is your statement of intent for why you want to do the research you want to do.
Okay, great. All right, you have seen the first cohort, including our friend Dr. Fisher, who had to leave, and the other students. What has been their reaction, their response in terms of the content of this program?
I think that definitely the 5 courses help them go on the right track when we talk about the research process. I definitely think so. What we've learned with our first cohort is definitely the heavy courses have to, as I said, have to be introduced to them in the longer semesters and not the summer semester. That was where I think their biggest challenge was. And so they do appreciate the content for all of these 5 courses. And now let's talk about the research paper now. So where that is now in terms of now restructuring how it is they get to the research paper course, we need to now make sure that we support them as much as possible so that when it comes to the research paper, we can say that we've guided them to go on track to see if it is they want to create a paper for being published, or is it just to get through the course and to get the qualifications? We've learned that a little better. So our second cohort, we're more able to say, this is why it's a 15-month course. And yes, the content is relevant. And hopefully, while we do the research paper, they learn even more so that they are able to present something as research output that is valid, that is worthy, and to be out there as the output.
Yeah. Just to add another little point is that I think the students have certainly come to appreciate the value of the skills that they learn in the health research environment. We have persons who have been able to submit their research work to academic conferences. One of our students will be presenting her findings at the upcoming Caribbean Public Health Agency conference in Yes.
That deserves a round of applause.
Yes, certainly, certainly. So that's
Yeah.
coming up in June. And also we have found that some of our students having been, having had their appetites whet, have wanted to go on. So some have actually opted to go on to the master's degree in epidemiology, which hopefully
Awesome.
start in this September as well. So I think clearly the interest is there, the opportunities are there. And I think the more once people get exposed, they will appreciate the benefits a lot more.
Great. Where are we seeing the students come from, Natalie, that you have seen? Are they just from Jamaica or are they from other parts of the Caribbean? Have we attracted any international students to date?
Not international, it's mainly the Caribbean. But I must say that in our second cohort, we have a wider mix in terms of it's not as many Jamaicans. In our first cohort, we had more Jamaicans, but we have a mixture of persons in the second cohort from Trinidad, so it's wider.
All right. And I want to bring in my colleague once more, Kathy Ann. The cost of the program, we haven't discussed that yet, and that's always one of the main points that help people to make the decision about whether to take up a course of this nature or not. What's the cost of the program?
Yes, our tuition fees are very affordable. This program in total costs $5,500 US, but as students, yes, and that seemed like a lot, but it's not a lot because students have the opportunity of paying per course. So they pay for what they register for each semester. And the 3 credit courses are $660 US per course, and the 4 credit courses are US $880.
Okay, so I mean, for a UE postgraduate diploma, costs $5,000. That's a really awesome investment. And if we follow Professor Ferguson's trajectory, should be a good return on the investment as well, Professor.
Well, certainly. I mean, if you are able to, even as a research assistant in the first year, you've probably paid back what you invested in the course.
Yes.
Look at it over a lifetime, you're going to pay back 100 or 1,000 times.
Yeah. Yeah, really, really, really good value. And I'm going to ask Kathy, and we only have 5 minutes. Believe it or not, our hour is almost gone. Kathy, and can you remind our audience about the application deadlines and the dates when they're supposed to submit the application and have all of their documentation in?
Certainly. Applications are going to close on July the 11th. And students have until the 31st to submit their documents. There are certain documents that students would have to submit with the application. These documents include their certificate, the marriage certificate, if that is applicant to the student, and there are, so those are the main documents.
All right, I think we're having some technical difficulties with Kathy and yeah. All right, so I think we have 3 minutes to go. I'm gonna give Natalie and Professor Ferguson 1 minute each to wrap up and give your final comments and encourage persons to sign up for this program. Let's go with Professor Ferguson.
Okay, so I would start by underscoring that we're in an era where public health decisions must be evidence-based. And I guess some of these we've seen with COVID. So just to probably look at an example, in the early days, there was the issue of hydroxychloroquine as a potential treatment agent. And it was not until this was tested in clinical trials that we were able to see that it did not really make a difference. If we do not have properly conducted research, we will make public health decisions and healthcare decisions that have the potential to cause harm. It is therefore critical that we develop expertise in health research develop is probably not the right word, expand expertise in health research in the Caribbean and beyond, so that all public health decisions can be supported by relevant data. In order to do that, we need a large cadre of trained professionals who understand how to conduct research, who understand how to interpret research. The postgraduate diploma in health research and epidemiology doesn't solve all the problems, but it's an important start. And we're really confident that if we have a larger number of persons receiving this training, we'll begin to have a large impact on health in the region. And therefore, we really believe that this program is useful and encourage as many persons as possible to join us on this journey, which should be quite an exciting one in improving health research in the Caribbean.
All right, thank you very much, Professor. Natalie, you have the last word.
So the postgraduate diploma in health research and epidemiology, as we said, it's the genesis. In other words, we can look at it as where we begin to make the impact as a region, how it is we can impact in our societies, and how it is we can better our health, and how it is we can actually reach as academics, because that's an important thing too. Right now, our cadre right now as facilitators is small. So even if we can reach out to say, what is the impact we can reach in educating one another in the region about health research, this is where we would start, so that from here we can grow globally.
Thank you so much. Thank you so much. Special thanks to you on our social media platforms who have joined us for this program and making it a success. Thanks, of course, to my panelists, Kathy and Lashley, the program manager here at Open Campus, Professor Trevor Ferguson from the Director of the Epidemiology Research Unit, Natalie, who you just heard from, and Dr. Lorianne Fisher, who is a graduate of the program, also a medical doctor. Thanks as well to my team in the background who have made all of this possible: Patrick Johnson, David Foster, Cherise Glasgow, Marcia Reed, and for handling all of your queries and comments. So I want to encourage you, the next time you're going to see the Open Campus live online is on Saturday, and you can see that in my background as my my profile, my graphic in the background. We are having a concert entitled One for Moms, and that is our Mother's Day concert this Saturday, starting at 8 p.m. Eastern Caribbean, that is 7 p.m. in Jamaica and 6 p.m. in Belize. Don't you miss it, it's gonna be awesome. Students from the Open Campus paying tributes to their mom, staff from the Open Campus paying tributes to their mom, as well as all the mothers in the Open Campus. As you know, at the Open Campus, a large percentage of our students are women, actually about 80%, and most of them are over 25. So naturally, most of them are mothers. So we're gonna be paying special tribute to our mothers on Saturday at the Open Campus Mother's Day concert, One for Moms. Don't miss it. Until then, I am Cleveland Sam. Take care. Bye-bye.